external oblique. And the fiber just opposite to the direction of the fibers of the external oblique, they are the next muscle, the next inner muscle, that is the internal oblique. As we have got the muscles in the thorax, external intercostal, internal intercostal, intercostal is intimal. Similarly, in the abdomen, we are getting, in the anterior abdominal wall, we are getting 3 muscles from outside inwards. That is the external oblique, internal oblique, and transversus abdominis. The external oblique, the muscle fibers are directed downwards, forwards, and medially. And internal oblique, the fibers are directed backwards and laterally. And the transversus abdominis muscle, they are taking both from the ribs and also from the pelvis, and they are directed, the fibers are directed transversely. Now, where we will get these muscles? Actually, the muscle fibers we will get on the lateral side. As we go medially, that muscles becomes aponeurotic. Aponeurotic. Aponeurotic means they becomes membrane-like, tendon-like structure. Okay. So, they are called external oblique aponeurosis, internal oblique aponeurosis, transversus abdominis. Okay, that also becomes aponeurotic. Okay. And more, if you go more inside, we will get another lining, that is the fascia transversalis. Fascia transversalis. And if you go more inside, we will get the parietal peritoneum. Peritoneum means it's a lining of all the abdominal viscera. They are in line with this particular lining that is called peritoneum. So, from outside inwards, external oblique, internal oblique, transversus abdominis, then we are getting the fascia transversalis, and most inside parietal peritoneum, and then we are entering the abdominal cavity. Now, these muscle fibers, they remains, actually we will get the muscle fibers on the lateral side, and when we go more medially, these fibers becomes aponeurotic, that is membrane-like. Now, we can see at the midline on either side, we can find one muscle, straight muscle on either side, and that muscle is straight. Straight is called rectus. We have seen the rectus femoris, straight. It has got a straight head and oblique head, but the muscle as if it is straight in nature, so it is called rectus. So, that muscle is called the rectus abdominis, and this muscle is taking origin from the symphysis pubis and the pubic crest, and it goes straight above. Okay, and ultimately we can see it is inserted into the 5th, 6th and 7th costal cartilages. So, that muscle is called the rectus abdominis. And we have said that there are muscles that they becomes membrane-like or aponeurotic, that is external oblique, internal oblique and transversus abdominis. These muscle and this aponeurosis, actually this aponeurosis and the muscle, they actually covers the rectus muscle and forms a sheet. Okay. which forms a sheath. Suppose one sheath is coming up, it gets splitted and it covers the muscle and again reunites at the middle. So this is the rectus sheath. So that muscle is under the coverage of one sheath, that is called rectus sheath, and its formation is actually it extends from the gyphoid process. This is the gyphoid process to the symphysis pubis, and within that, and here we can see this muscle, we can see the rectus muscle, and in the midline we can get a white line. In between two rectus abdominis muscle, we can find one white line, and that white line is called the alba, and linear in structure, so it is called the linear alba. On either side we are getting the muscle, and sometimes we can get another muscle which looks like which has got a pyramidal in shape, okay, which is not shown in this figure, that is called the pyramidalis. So rectus abdominis and pyramidalis muscle we can find, okay, in the anterior abdominal wall, where just on either side of the midline. So they are 1 in number on either side, 1 plus 1, the 2 rectus muscle. So origin is from the symphysis pubis and from the pubic crest, and then it is going straight upwards and it is inserted into the 5th, 6th and 7th costal cartilage, and most medial fibers goes to up to the xiphoid process. First this muscle and continued up to the midline, that is the linea alba. And also we can find these 3 or 4 connective tissue septa, they are present, okay, just above the, generally above the umbilicus. Below the umbilicus we can also get that septa, and this septa is continued. Suppose this is the anterior wall of the rectus sheath and this is the posterior wall of the rectus sheath. They are continued from the anterior to the muscle. From anterior wall of the rectus sheath to the muscle fibers, they are continued. They are called the tendinous intersection. This is called tendinous intersection. We can find these are the tendinous intersections. Okay, and it is named in other way, or linea transversalis. But actually they are called in somebody called them as the abdominal ribs. Somebody says the rectus muscle is segmental in origin, so they are the segmentation. They are the separate. They actually shows the different segments. We have dissected. We can see. You can see the tendinous intersection. Here we can see the muscle of the anterior abdominal wall. Okay, but we are concerned with, actually this is the external oblique. Okay, and this one, here we can find the muscle, that is the external oblique. So fibers are directed downwards, forwards and medially, and in this figure we can see the fibers which are just opposite to it. We can find the internal oblique muscle. Okay, in this figure we can see the rectus abdominis muscle. You can see this is originating from the pubic crest. Which one is the pubic crest? This is a pubic bone. Over here we can find on linear ridge, that is called pubic crest, and this is the symphysis pubis. So it is originating from the pubic crest and the symphysis pubis, and it is directed above, and we can find it is inserted into the ribs. What are the positions? One at the level of the xiphoid process, one at the level of generally at the level of the umbilicus, and in between we can get the third one, and fourth one we can get even below the umbilicus. Okay, so this tendinous intersection, they are attached to the anterior wall of the sheath. We have removed the here we have removed the they have removed the anterior wall. Suppose this is the linea alba, anterior wall to this tendinous intersection. These are the connections. So below the umbilicus, the anterior wall of the rectus sheath is free. No, generally there is no tendinous intersection. But above the umbilicus, there is a connection between the anterior wall and the rectus sheath. So when we are dissecting, so we can find there is an obstruction. Okay, so we have to remove the obstruction, and we can see this tendinous intersection. And if we remove this muscle, then we can get this area, okay, where we can get this area. This is the posterior wall. So posterior wall is generally formed by, we can see this is the posterior wall of the rectus sheath, and within the posterior wall of the rectus sheath we can get an arcuate line below the in between umbilicus and symphysis pubis. On the posterior wall we can find a semicircular opening, okay, that is called arcuate line or linea semicircularis or arcuate line of Douglas. Okay, so this is the picture of the posterior wall. Here the muscle is removed, the rectus muscle is removed, we can see the posterior wall. So here we can see the rectus muscle, as well as we can see in the lower part a pyramidal shaped small muscle. Okay, we have seen the plantaris muscle. Like plantaris, we may find this muscle. Not in all body we can get. In all cadaver we may not get this muscle. So that muscle, which is again also taking origin from the same place, okay, and the muscle fibers are inserted over the linea alba. So that is called pyramidalis. Rectus abdominis, and this is the pyramidalis muscle. So this figure shows the formation or orientation of the rectus sheath. Which one is the rectus muscle? This one is the rectus muscle on either side. This is one and this is another one, and this is the linea alba, this is the midline. So from anterior to posterior we can see this muscle. This is the external oblique, internal oblique and transversus abdominis. You can see where we can see this typical picture below the arcuate line, and we can see the posterior wall is solely formed by this fascia, which is called the fascia transversalis. So the formation of rectus sheath is different at different level. From xiphoid process up to the midline of in between xiphoid process and umbilicus, that means at up to this level it is different, and again from this level to up to the midpoint between the umbilicus and symphysis pubis, the formation is different. Okay, but here this point, this is the midpoint between the xiphoid and umbilicus to the midpoint between the umbilicus and the symphysis pubis. Here we are getting all the real formation of the rectus abdominis. Here you can see the anterior wall is formed by, in this figure what you can see, it is formed by the external oblique aponeurosis, internal oblique aponeurosis and transversus abdominis. No, it is below that level. So in this level where we can get the real picture of the rectus abdominis, actually the anterior wall is formed by the external oblique aponeurosis, and internal oblique aponeurosis is split into two parts. One is anterior lamella, one is posterior lamella. So in this level, the anterior wall is formed only by the external oblique of aponeurosis and the anterior layer of the internal oblique. Okay, and posterior wall is formed by the posterior lamina of the internal oblique and by another layer. It is coming from the transversus abdominis. So that is the it is the aponeurosis of the transversus abdominis. Okay, so this is what is called the rectus abdominis. Okay, now behind the rectus abdominis, okay, we can get one vessel. Just remember, in the posterior wall of the rectus abdominis, we can find one artery is coming from below and one artery is coming from above, and at the level of umbilicus there is an anastomosis between two vessels. There one is called inferior epigastric, one is called superior epigastric. Inferior epigastric is coming from external iliac artery. Okay, and superior epigastric is nothing but you have seen the internal thoracic artery or internal mammary artery, which runs just by the side of the sternum, and in the actually on the sixth space it is divided into musculophrenic and superior epigastric. So one artery is coming from above, that is the superior epigastric. One artery is coming from the below, that is the inferior epigastric. So at the level of the umbilicus, generally we can find this anastomosis on the just in front of the posterior wall of the rectus sheath. But there is no absolute. We cannot have an absolute idea, because here we are getting that anastomosis behind the rectus sheath. Okay, so let us see all the layers, then we can have the orientation.